Hello, it's Dr. YouTube here, where I upload medical educational videos for nursing and allied healthcare professionals, including medical students. In this episode, I'll talk about the three different types of ascending pathways into the brain for sensation. The first one I'll talk about was the spinocerebellar. This is probably the most simplest one. The reason is because, unlike the other two, they do not cross the spinal cord. So what that means is, if you imagine here, you've got your dorsal ganglion. So you've got your the spinocerebellar tract. First of all, senses for unconscious proprioception. So you've got sensation there, unconscious proprioception. For example, joints, going from there all the way in to the spinal cord. It does not cross. So that's your first order neuron. Your second neuron is going up to the cerebellum. It does not go to the cerebral cortex. Therefore, it's unconscious. So that's your spinocerebellar tract. First order does not cross. Second order does not cross as well. Spinocerebellar tract. How about the second type? The second type we'll talk about is the posterior column. The posterior column is basically used for discriminant touch. So that's basically fine touch and also conscious proprioception. Now this does cross the this does cross, unlike the spinocerebellar tract, and it crosses at the second order at the medulla. Okay, so first order fine touch and conscious proprioception. First order going to the medulla. Second order crosses at the medulla and going to the thalamus in the brain. The thalamus, there's a third order from the thalamus to the cerebral cortex. So actually there are three three order neurons. The last one from the thalamus to the cerebral cortex. So just to recap, the posterior column is for conscious proprioception and also for fine touch. There are three order neurons. The first does not cross. The second does cross, but that is at the medulla. And the third order is from the thalamus to the cerebral cortex. Now the posterior column consists of Fasciculus Gracilius and cuneatus. And the way of remembering that is the gracilis. Gracilis is a muscle in the thighs, medial thighs, and so that's basically sensation for the lower trunk. Cuneatus is like cervical area, if you just C for cervical, and that's the upper trunk. So gracilis for lower trunk, cuneatus for upper trunk. And lastly, the spinothalamic tract. The spinothalamic tract is divided into the anterior and lateral tracts. But first of all, the anterior is more of touch and pressure, crude touch and pressure, and for the lateral spinothalamic, I remember this by P. P is pain, T is for temperature. Okay, so now remember the posterior column crosses at the second order neuron at the medulla, but in the spinothalamic tract it actually crosses in the second, but rather than the medulla, it crosses at the spinal area there. It's called the spinal lemniscus, as you can see there, spinal lemniscus. First order, second order at the spinal lemniscus at the level of entry. Again, all the way to the thalamus, at what we call the VPL nucleus, ventral posterior lateral nucleus of the thalamus, and from the third order going up to the cerebral cortex. So let's just do a very quick recap. remember, the spinocerebellar is unconscious, so does not cross, and also does not go to the cerebral cortex. It goes as a first order and second order all the way up to the cerebellum without crossing, and it's for unconscious proprioception. For the posterior column, it is for the gracilis, which is the lower trunk. Remember the gracilis being the thigh muscle, and the cuneatus, the cervical, so that's upper trunk. It is for conscious proprioception and also for fine touch. It does cross at the second order neuron, but at the medulla, and from the medulla to the thalamus, from the thalamus, you have the third order going to the cerebral cortex. And finally, your anterolateral spinothalamic tracts. Your lateral, P is for pain, T is for temperature, and also for your anterior is for the crude touch and pressure. It like the posterior column, it also crosses in the second order, but it crosses straight away at the level of spinal cord, which is the spinal meniscus in the second order neuron, as you can see there. Before heading back to the VPL, ventral posterolateral thalamus, and then from the third order there to the cerebral cortex. So, I hope you've enjoyed this video. If you do, please give it a thumbs up, subscribe, and like. Take care and look after your spinal tracts.